Can your doctor deny your Medicare plan? Well, yes and no. Let's talk about it. Hey, as always, if you have questions about your Medicare or health insurance in general, you can reach us in the comments below or at the number on the screen. A reminder that we are licensed health insurance brokers and we're licensed nationwide, and of course, there's absolutely no charge for our services. All right, let's get to it. Although it is very unlikely that your doctor would deny you original Medicare, there are several parts to Medicare, and that's where things can get confusing. There's Part A, which is your hospital insurance, Part B, which is basically any time you see a doctor, Part C, which are Medicare Advantage plans, Part D, which are prescription drug plans, and then there's Medigap, also known as Medicare Supplement plans. So original Medicare is Part A and Part B. And it is highly unlikely that your doctor wouldn't accept original Medicare. There are actually no networks with original Medicare, and it's estimated that somewhere around 97% of doctors accept original Medicare. So maybe it's not that your doctor doesn't accept original Medicare, maybe it's that that specific service isn't covered. So let's take a look at the benefits of original Medicare.
On Medicare.gov, you can find out what Part A covers and what Part B covers. Part A, which is your hospital insurance, basically, inpatient care in hospital, skilled nursing facility care or nursing home care that is not to be confused with long-term or custodial care, hospice care and home health care. And then Part B is basically any time you see a doctor. It'll also cover insulin if it's administered via pump, and then things like clinical research, ambulance, durable medical equipment. So that would be like wheelchairs, walkers, mental health, both inpatient and outpatient, and very limited outpatient prescription drugs. These are mostly vaccinations or drugs administered via doctor, or even chemotherapy or oral anti-cancer drugs. Now, if you look to see what isn't covered by Part A and Part B, these are some of the things that you might assume would be covered by original Medicare, but aren't. Long-term care, which is custodial care, this is basically the type of care for when you don't expect to recover from an illness. So something like Alzheimer's wouldn't qualify you for a skilled nursing facility because it's not something that you expect to recover from. Skilled nursing facility care is mostly for rehabilitative and habilitative services after a surgery or procedure in a hospital. Dental care isn't covered by Medicare. Eye exams for prescriptions, dentures, cosmetic surgery, massage therapy, hearing aids and exams. That being said, hearing aids are now available over the counter, which is a major improvement for those in need of hearing aids because they would be very, very expensive without insurance coverage. Concierge care, which is concierge medicine, which is an agreement with your doctor. And then it basically says that if you do choose to see a doctor that it doesn't accept Medicare, which again, most do, then that wouldn't be covered unless it's an emergency.
So what about Medigap? Well, Medigap is also known as Medicare Supplement plans, and they fill in the financial gaps of original Medicare. Now, although they don't offer additional benefits not offered by original Medicare, there are definitely many positive reasons why you would want to enroll in a Medigap plan. There are 10 different plans with varying levels of coverage. So here are the 10 Medigap plans available. Plan A, B, C, D, F, G, K, L, M, and N. And this chart just details what benefits are offered by which plan. Now remember, Medigap plans aren't going to offer additional benefits that aren't already offered by original Medicare. For example, original Medicare doesn't offer dental benefits, so you're not going to see that any of these plans offer dental benefits. Instead, what they're going to do is help to cover or possibly entirely cover copays, coinsurance, and deductibles. So basically, you pay a little bit extra, but almost all of your out-of-pocket expenses, or possibly all of your out-of-pocket expenses, will be taken care of. So you can see that all of the plans will cover your Part A coinsurance, which is extremely helpful. All the plans will cover in some capacity Part B coinsurance or copays. Plans K and L are known as cost-sharing plans. So basically, they're going to contribute to these out-of-pocket costs, but Plan K will cover 50% of your cost, and Plan L will cover 75%, and that's just pretty much, generally speaking, across the board. All the plans will cover the first 3 pints of blood in case of need of transfusion. Part A, hospice care, coinsurance or copays, that's very important. Skilled nursing facility care coinsurance, again, very, very important. The only plans that don't offer that is Plan A and Plan B. Your Part A deductible, that's that deductible that's applied per benefit period. So if you do need to be hospitalized more than once in a given year, then you might have to meet that deductible again, and that can certainly be very expensive.
The Part B deductible, no plans that are offered to new enrollees are going to cover that Part B deductible, but that's a once annual deductible and it's not very expensive, so it's not your biggest concern. Part B excess charges. So basically, if your doctor accepts original Medicare, then they accept the amount that Medicare is willing to pay out. However, they can choose to charge an excess charge, which is up to 15% more. Now, I wouldn't necessarily worry about these because they're not all that common and they're not even permissible in all states. The only plans that do cover Part B excess charges are plans F and G. Plan F is one of those plans that's not offered to new enrollees, but if you are looking for the most comprehensive coverage available to everyone, then that would be Plan G. Foreign travel, almost all plans will cover that in some capacity, 80%. And then there's this out-of-pocket limit. You'll see it's asterisked here because it's not really applicable. For example, Plan F and Plan G, and even to an extent Plan N, are really going to cover all of your out-of-pocket expenses except for possibly that Part B deductible. Plans K and Plan L, because they are the cost-sharing plans, they do have an out-of-pocket maximum, which is very helpful because if you do have major medical bills, original Medicare doesn't have any type of limit or threshold on what your spending could be. So when you're comparing prices on Medicare.gov for the different plans, you're going to see that there's a range of prices available to you for each of the plans. So let's go with one of the more popular plans, which would be Plan G. And we're going to click over here where it says View Policies. Then if you scroll down, you'll see that these are all of the carriers that offer Plan G in your area based on the information that I've put in and the approximate costs. So as you can see, they are offered by private carriers. So what exactly does that mean? Well, you may recognize some of these carriers or perhaps not. You'll probably recognize something like Allstate, but maybe not Nassau Life Insurance Company.
So as you can see, these are offered by private carriers. So does that mean that if your doctor doesn't accept your carrier, if they're not within network, that they might reject your plan? Actually, no. If your doctor accepts original Medicare, they accept your Medicare supplement plan regardless of who the carrier is. And as we said earlier in the video, almost all doctors accept original Medicare. And because the benefits don't vary from carrier to carrier, you can pretty much shop based on price alone. But a warning, prices do tend to increase on a yearly basis to accommodate for inflation and rising healthcare costs. So it's important that you not only pick a plan that currently has a lower price, but a carrier that has a history of lower and more stable increases as opposed to more erratic and dramatic rate increases. Remember that should you choose to enroll outside that initial 6-month window, you may be subject to medical underwriting, which means you could be charged more or denied outright. So it's not like it's easy to shop a new Medigap plan every single year. And that's why it's a good idea to work with a broker who's familiar with the history of rate increases with various carriers. If you're liking this content, make sure to like and subscribe. Now I'm going to jump past Part D because Part D really is irrelevant to this conversation. Part D are strictly prescription drug plans, which means your doctor doesn't really have much to do with them. However, do make sure that the prescriptions that your doctor is prescribing are included on your Part D formulary. Now on to the main event, which is Medicare Part C, also known as Medicare Advantage plans. These are managed care plans that are offered by private carriers, and they are a replacement to original Medicare. And this is where things can get a little dicey. Unlike with Medigap plans, aka Medicare supplement plans, your carrier with a Medicare Advantage plan is very important. And many doctors don't like to contract with Medicare Advantage plans at all.
So this little chart details some of the differences between original Medicare and Medicare Advantage and the pros and cons of Medicare Advantage. So for example, Medicare Advantage offers an out-of-pocket maximum not offered by original Medicare. It also may offer dental, vision, hearing, and prescription drugs, which is certainly nice to have included in your health plan. However, there are often very restrictive networks with Medicare Advantage, and really that's not even the problem. The main problem and why many doctors don't like to contract with Medicare Advantage plans is that these are managed care plans. So not only do they require referrals to see a specialist if you go with an HMO, but there's the issue of pre-authorization. So even if your doctor recommends that you see a specialist or get a specific treatment or service, your insurance carrier has to approve it as well.
Now, there are pros and cons to Medicare Advantage plans, and if you've decided that a Medicare Advantage plan is right for you, you should know that you can choose between an HMO and a PPO. And a PPO will give you much more flexibility, and it's much more likely that your doctor will accept your plan because you'll have coverage in and out of network. So if you ever had a doctor deny your Medicare plan, let us know in the comments below. Also, if you have any questions, you can reach us not only at the number on the screen, but of course in the comments. We would love to hear from you. And please make sure to like and subscribe. We'll see you next time.
Before you go, make sure to like and subscribe, and make sure to check out this video to learn if you're on track for your retirement. We'll see you next time.